Many of us must have thought about how sleep affects our mental health, physical health, and cognitive performance. But does sleep affect our sexual activity?
Getting enough sleep promotes healthy sexual desire. However, poorer subjective sleep quality can increase sexual arousal but not sexual frequency. Now, does sexual activity before bed affect our sleep? Sexual intercourse followed by orgasm can facilitate sleep, but masturbation at bedtime has no effect on sleep that follows. Now let's look into the examples of how this may affect individuals' lives. Leslie and Bianca are considering marriage counselling due to Bianca's parasomnia. Parasomnia is a disorder characterized by abnormal behavior of the nervous system during sleep. This may include sleep-related sexual behavior with oneself or the bed partner, which may take a toll on relationships. One study found that all participants with parasomnia reported adverse psychological and physical effects of sleep sex. The patient may feel denial, guilt, embarrassment, low self-esteem, and shame. Bed partners could experience shock, annoyance, worry, and even bruising. Reactive emotional distancing can often lead to marital estrangement for those with parasomnia. However, Leslie and Bianca are trying to overcome this with the help of couples counselling and other medical professionals. Sleep-related disorders can cause abnormal sexual behaviours in wakefulness too. Meet Ryan. He lives in apartment 12. Ryan struggles with getting to sleep and finds himself waking up several times during the night. He has also found himself in awkward situations due to his sexual thoughts and behaviours, including being sexually aroused at family gatherings, constant thoughts about sex at work, and struggling to maintain relationships due to inappropriate bursts of sexual behaviour. Ryan met up with his friend Amy. She told him about someone she worked with going through legal consequences because he was suffering from the same symptoms as Ryan. Kleiner-Levin syndrome involves sexual hallucinations, hypersexuality, and sexual delusions. It is a rare sleep disorder characterized by long episodes of hypersomnia where patients have no self-awareness of the inappropriateness of their behaviors. Dr. Radburn suggests Ryan attend therapy sessions to resolve his underlying issues and develop methods to overcome his deviant behavior. Further research has found that some people are better treated through medication to help manage and control unwanted sexual behaviors. Now, let's meet Jamie in apartment 18. Jamie is single and lives by himself, but has recently been wanting to get onto the dating scene and meet someone to settle down with. However, he has lost confidence due to his lowered sexual drive, which has been causing him significant distress. Jamie's doctor informs him that his struggles may be an effect of his sleep apnea.
Obstructive sleep apnea is a condition where the airways are blocked during sleep, leading to sleep disturbances. Symptoms include snoring and loud breathing. Current research has found sexual dysfunction in men and women suffering from sleep apnea, and psychological factors are found to contribute to the issue. With proper treatment, Jamie can regain confidence and begin dating.
Next, we have Sally and Patrick Hill.
Sally is going through menopause and has been experiencing a number of distressing symptoms. Her moodiness, lack of sleep, and lack of sex drive has affected her relationship with Patrick.
Between 25 and 50% of menopausal women complain about sleep disturbances.
The change in hormone levels during menopause can impact on sleep through the circadian rhythms. Research has found low levels of female sex hormones to be associated with sleep-disordered breathing. Sally is considering hormonal treatment but wants to assess the pros and cons first. Estrogen may benefit sleep-disordered breathing, but there's some evidence linking it to an increased risk for cardiovascular disease and dementia, which Sally may want to consider. So we've learnt the link between sleep and sex is bidirectional and mediated by sex drive and the quality of relationships. Sleep-related disorders also affect sexual activity. And sexual changes such as menopause can affect sleep and the risk of sleep disorders. Thank you so much for watching our video. We hope you've learnt something new today.